telling the truth.
Oh, that's a relief. I was afraid I wouldn't be able to use a liar, liar pants on fire defense.
Hey, what about you?
I fit in better than you. At least I'm wearing cowboy boots.
Must be hard being a king.
How did I do?
There is now a revolution.
You're the best, man. Come on, Benny, man. The kid is a L7 weenie.
We are moving on this fine Tuesday, and as we do Tuesday at 5 o'clock, we had none other than Megan Olson in. Megan Olson does the Alpha News and Review. We take the news stories that Alpha has done, the top most popular stories of the week. We tweeted, we posted, we done, reshared, whatever they do with it. We talk with Megan about it. Megan, thanks for coming on the program.
Yeah, thanks for having me on. It was a busy New Year's week for sure in the news industry.
I tell you what, you talk about that. In your guys' line of work, people do crazier stuff around the holidays. Doesn't matter. It's not a time where you guys can take, let's take the week between Christmas and New Year's off. That's when the loons come out.
Mm-hmm. Exactly. And that's one of the stories, too, that we're talking about today is that there was a huge shooting at the Mall of America on New Year's Eve. And it was chaotic and scary. I had friends posting on Facebook that they had kids that were working. They were all on lockdown. And yeah, truly people get a little bit crazy around the holidays.
And do they figure out what that was all? But I never get why somebody's shooting other people. But do they figure out why this happened? Just random folks walking down the mall and decided to pop somebody off? How does the mall thing work?
Yeah, it was one of those things where just people were arguing and someone pulled out a gun, essentially. So it wasn't really a mass shooting. The Mall of America wasn't really like a target. There was no real threat outside of these two individuals, but one person was struck in the leg and another person was grazed.
Maybe I'm nuts here, but I remember maybe they've taken it down. But at one time at the mall, they had signs up, no guns on this property.
I don't know if they still do that anymore.
Oh, because at one time, especially after, 9/11, you were walking through metal detectors to get in the mall. They were scared of what was going on. That obviously isn't the case. There's no metal detectors, I presume. I've not been to the mall for forever.
There's been a lot of rule changes in the Mall of America over the years too. I know when I was growing up, they had the weekend rule where if you were under 18 or 16 or something, you couldn't be in the mall without an adult after 4 p.m. on the weekends. Now I think that's a daily thing. They're trying to keep the riffraff out, but I don't understand how these individuals at the Mall of America had an argument and then all of a sudden someone just whips out a gun because they're just that angry. It just seems a little bit psychotic.
But I'm with you. Son home from school had a friend that works at the mall, and that's how he heard about it before it made the news. There's a shooting in the building. They closed everything down. How long does that take? Any idea? The police obviously roll in, the mall police. Mm-hmm. Did they catch this cat?
Yeah, I'm not sure if they caught him, but in this instance, they did respond to it immediately. They were there within a minute at the scene, and also right when it happened, Seek Shelter immediately was playing over the speakers in the entire mall. So the response there was pretty quick. I mean, they're mall cops.
How quickly do they open that back up?
Huh?
You're in the Gap. Do they still have the Gap? Is the Gap store there?
Yeah.
All right, you're in the Gap. The thing says Seek Shelter immediately. Everything locks down. How long until you're able to leave the Gap? I mean, are you talking hours? Do they got crime scene tape?
I think they ruled out that this wasn't a mass shooting right away, so they realized there wasn't a public threat. But this happened, something similar happened when the Black Lives Matter movement started a couple of years back around the holidays. My dad was actually Christmas shopping at the Mall of America when this happened, and some brawl or something broke out. I don't think firearms were involved, but there was definitely a risk. So all the stores shut down. Even if you were a customer in a store, like you were locked in, they shut the gates, they locked them, you were on lockdown. And it's a pretty scary thing to think about, 16-year-olds having their first job working at the Gap or Old Navy or Athleta, whatever, and you're having to experience this.
Well, that's different. So they lock everybody in the Gap store. Oh, my thought was they're kicking everybody in the hallway and walking out.
It's like shelter in place. In place.
These people are thinking now. Okay, that makes sense.
Yes.
Sure. All right, what else you got for me today?
Yeah, so that that happened on New Year's Eve, and now we're into the new year, and there's a new year, there's new laws. So we wrote a story that gained a lot of attention because there's a lot of different things coming to light here in Minnesota in 2022 about property forfeiture, also about suspending your driver's license. So one new law that goes into effect is that the Department of Public Safety can't suspend someone's driver's license if they fail to appear in court after a citation, they don't pay a traffic ticket, or they drive after a suspension or their license is revoked.
Okay,
so,
you hold on.
which that doesn't make sense, but
I literally, when you wrote that, I ran a copy of that because I wanted to use that as a bit. Somebody explained this to me. You cannot lose your license if you're driving with a suspended license. What? What?
It's revoked. So like,
If you don't have a license, you're driving without a license because it was revoked. You can't have it taken away from you for driving without it.
Yep.
Who in the heck writes that? What the heck?
Well, what's more concerning is that they can't suspend your license after you don't appear in court for your citation. Okay, quite frankly, you're not paying attention to, what's being filed against you. You deserve to lose your license. You're not following the law.
Whatever you did, the court says you got to show up on this date or you're going to lose your license. You don't show up. You know what you do? You lose your license. The idea is that, well, I'm not going. They can't take it from me anyway. So there are no real driver license rules anymore. You're going to always have it because they can't take it from you.
Oh, and you can not pay your traffic ticket now because you're not going to lose your license.
What does the state get out of this?
Yeah.
Why is that something that makes any sense whatsoever? I don't have to pay my fines. They're not going to take my license. You just rack up fines. Nothing's going to happen to you. I'm driving without a license. Yep, no problem. I can't do anything about it anyway. Does anyone need to get a driver's license anymore? What difference does it make?
I don't know. And it's crazy now too, because now they're charging people who don't show up for driver's tests as well because they're so swamped. And it's comical. But
are we not to the point that every driver station should be back open now? Are we not to that point? 60% are vaccinated, whatever. How are we not getting these driver licenses taken care of?
Yeah, I'm not sure. And we're also talking about, in Minneapolis, they give out not necessarily licenses, but just IDs to illegals as well. So there's a multitude of things that are happening in that department. But another new law states that vehicles cannot be fortified if a driver does not appear in court, but they can be fortified if
forfeited.
Forfeited, yes, if they were used to transport or exchange controlled substances. So this is an attempt to crack down on, opioids, drug trafficking, that kind of thing, personal property and all that. And cash can also be taken if there's probable cause to believe that the proceeds or that property was purchased with money that came from these controlled substances. So that's another interesting thing happening.
That's the trade out. You can keep your license, but we're taking the crack and the crack money.
Mm-hmm.
It's a trade out. Right, we got to go to break. You can't tell me we're not talking some Omicron and all this. That there isn't any.
We're talking about cloth masks and how they're not really working and how Omicron favors the vaccinated now.
We'll talk about that next. This is going to get my blood boiling. We've got her, Megan Olson, Alpha News and Review.
It's more of your friend that knows a guy, Al in the afternoon.
Megan Olson, Alpha News and Review. Megan, I am so happy that we're gonna talk about this story you guys ran. I posted on Al in the Afternoon, my Facebook page, whenever it came out. It would have been yesterday. I was stunned by it. Had a couple of people already comment on my Facebook page, and you got to be kidding me. I've said this before. You might as well say whatever you want about this virus because you'll be right next week. If you're wrong today, you'll be right. And if you're right today, you'll be wrong next week. Nothing we know about this stands. And I think people will be shocked if I can lead you into this from around the world. They're talking now nationwide studies across the world. 81% of Canadian Omicron cases are among those fully vaccinated. 81%. In Germany, that number is 95.6%. And 71% of the population is vaccinated, and 95% of those cases are from the fully vaccinated. 61% in Israel are among those who are triple vaccinated. And this is at the same time, we'll talk, I hope, in a bit, that the Mayo Clinic is firing people for not taking the shot. Well, tell me what shot? The first shot? The second shot? The booster shot?
The booster.
These people are, the booster? These people are getting Omicron. It's not protecting anybody. Why are we firing nurses? Well, let's not get to that. How can that even be true?
Well, and one of the more striking stories or instances in a country or continent, if you will, that you didn't mention that was in this article is about 25 Belgian staffers went to a research station in Antarctica. They were all fully vaccinated. They all passed multiple PCR tests. They all quarantined before arrival. Now, 2/3 of them have the Omicron variant of COVID. So this is a really pervasive strain. It's also not as severe. So I guess that's the upside to it. But also we're learning that cloth masks don't protect anyone against this variant. You need to have the KN95s.
Well, and even that is not going to necessarily save you as long as you're wearing it all the time. And it's got to be a real 95 mask. There's other ones out that aren't quite right. But literally you're having folks come on the national news on Sunday. One, the CDC go, oh, wear the mask. Then you got, what's his name, Fauci coming out. Well, doesn't really help a ton. I mean, we realize that the mixed signals are nuts. And here's my point. The 30% of Americans are in Minnesota that have not been vaccinated. I'm sorry. At some point, I'm just going to say we're completely correct. Laugh at the rest of us. This is nuts. To sit there and say 95.6% of those vaccinated in Germany are getting infected with this new thing. The shot means nothing.
Only 4.42% is that what that means is 4.42% of the Omicron cases in Germany are the unvaccinated. So we've totally flipped this entire narrative of COVID cases on its head. This is the same pattern we're seeing in Florida, in Iceland, the UK,
and no one's going to
Denmark, all of it.
No one's going to ask me. I'm telling you that 4% of the people that had the regular coronavirus didn't get the shot, and they're the ones who are not getting it. They're fine. They have the natural immunity. They're not giving us the whole story, and I'm sorry, that just ticks me off because you go listen to this stuff all the time, and these kind of studies come out. That's crazy. Then
at the same time, we have this going on with Omicron. We have this whole panic narrative that has been crafted since day one about the ICU beds, especially here in Minnesota, about, we don't have enough beds. We're over capacity. We don't have enough staff, XYZ, whatever. But now the Children's Hospital in St. Paul is swapping out their ICU COVID beds for mental health beds. So we're seeing that this pandemic is actually doing more harm than good to the mental health of our youth.
Well, of course it is. I think that actually thank you to the Children's Hospital for doing that. Somebody's got to take care of these kids. We're going to look back at this and say, what the world did we do? But what gets me is that I want to say, because I kind of follow this stuff, there were like 3,000 ICU beds when this thing all started 2 years ago. I don't remember what the number was. When we counted all of the ICU, we had 3,000, whatever it was. Well, now we're at 1,300 people in the ICU, and they're saying we're running out of beds. Where'd they go? And it isn't that we run out of beds. You know what it is? They're getting rid of these nurses. They're getting rid of people and saying we don't have enough people to staff them.
And then crying people over a staffing problem. They're saying they have staffing problems, but they're getting rid of their staff. They're getting rid of people who are ready and willing to work.
So my point is, I think, maybe I'm wrong, but I think many people are getting to understand this. Nothing adds up. 2 and 2 is not 4 in this situation. You're literally the Mayo Clinic, and I'm sorry, they're fantastic. Firing unvaccinated employees in the middle of a labor shortage makes no sense. The fire them when literally the news comes out today and saying those with the vaccine are the ones getting sick. They're the ones getting the Omicron and spreading the darn thing.
And I would argue, and I'm sure you would agree, that the mental health crisis, especially in the youth, is arguably way, way more important and deserves way more resources and attention from our government than it's getting. Pew Research reported that girls ages 12 to 17, suicide rates have jumped over 50% during the COVID lockdown period. The Minnesota's own Department of Human Services is saying there's a 30% increase in kids showing up in the ER having mental health crises. So probably like considering suicide and needing to be on a suicide watch. Like these are seriously horrible statistics, and there's no outcry from the mainstream media.
Those numbers are so much higher than any of these young men and women's chance of getting anywhere near ill with any of these variants. If you're under 18, you got statistically no chance of getting killed on this, but suicide kills. It's craziness way we're running.
At the same time, too, we have, I think Biden is circumventing the FDA process for the boosters for 12 to 15 or 12 to 17-year-olds. So the booster for that age group will not be undergoing the same type of FDA regulations and, hoops it has to jump through in order to come to market. So there's that concern there as well. I mean, I'm all for, if you want to get vaccinated, you go get vaccinated, but let's not make this a war on vaccinated versus unvaccinated. Let's not alienate the unvaccinated, because it's clear that they are not the problem.
They are not the problem. And what gets me is now this Pfizer thing comes out and the FDA just approves this booster shot now for whatever it is, 5 to 18-year-olds. What are we talking about? How much research could they have done if we just got the actual shots out within the last year that we have any clue what the booster will do in the next 6 months? They're not enough months to add it up.
It's going to be rolling out, I think, here shortly, the at-home COVID tests from the Biden administration. About 2 million of them are going to be shipped out, particularly, I think, first to high-risk communities, I guess, whatever that means in their eyes, that you could take that a lot of different ways.
Well, if you're reading Alpha News, it's going to go to everybody that's already got the shot. They're the high-risk people. Here's what they don't understand, and I can't believe they're not going to learn this for Vermont. I don't know if it wasn't in yours. I saw it on a news thing, and we're going to run out of time. In Vermont, just before Christmas, they mailed out a bunch of the home kits. Their government said, we're going to make sure you test before you go to your family's house. They were overrun in the ER. All these people, no symptoms, but they're going to do the swab before they take off for their aunt and uncles. Oh, no, it's positive. Then they all race to the ER to have the real test to prove it before they went, and it flooded the ERs had to stop. And I'm like, if you really wanted the test and you're going to jam that up your nose, if you could better be ready to say, if it comes back positive, we're staying home. We're not going to the ER. We have no symptoms. These people came with no symptoms. They just had a stick that said they had it.
Well, then we have the NFL saying the asymptomatic don't spread the virus. Like, where it's comical at the end of the day. Al, this is the most worked up I have been in weeks. I can't take it.
The craziness from one story you guys put out to the next story. Again, 2 + 2 is not equaling 4 anymore, and it's driving me through the roof. The idea that the Mayo Clinic would fire unvaccinated folks when they can't say, here's the proof. You take the shot, you're not going to spread it. We now know they spread it. The shot doesn't. Who's the shot helping?
Yeah. The Minnesota Department of Health numbers are still a week behind on all that reporting. So hopefully next week we can chat a little bit about how detrimental the holidays were, how many people got COVID, whatever. But remember, we're only focusing on deaths and hospitalizations now, according to our president.
Well, I've missed the last 2 weeks. We have not seen the re-vaccinated, what do they call the breakthrough cases? Those are at 10, 11,000 a week. They haven't published that. They haven't done it in 2 weeks. You know why? Those numbers have jumped through the roof with this Omicron, and they don't want the world to know it. I hate that they hide stuff. Megan Olson, we're out of time. Megan Olson, Alpha News and Review. Love having you on. You have a good week.
You too.